Scaphoid fractures. A fall on an outstretched arm may result in more than a wrist pain or sprain. Such a fall may cause a fracture of the scaphoid bone in the wrist. A scaphoid is one of the 8 small carpal bones. The scaphoid bone is a boat-shaped bone in the wrist. The carpal bones are arranged in 2 rows at the base of the hand: proximal carpal row and distal carpal row. The proximal carpal row consists of 4 bones: scaphoid, lunate, triquetrum, pisiform. The distal carpal row, trapezium, trapezoid, capitate, and hamate. The scaphoid bone is positioned on the thumb side of the wrist, just above the radius. This bone is important for both motion and stability in the wrist joint. Scaphoid fractures are classified according to the severity of displacement, that is, how far the pieces of bone have moved out of their normal position into non-displaced fracture and displaced fracture. These fractures are also classified according to the time since injury to acute fractures, less than 3 weeks. Delayed union, from 4 to 6 months. Non-union, more than 6 months. The most common classification of scaphoid fractures categorizes them by location: distal third or distal pole fractures, central third or waist fractures, and proximal third or proximal pole fractures. Approximately 65% of scaphoid fractures occur at the waist, 25% at the proximal pole, 10% at the distal body. The interesting thing about the scaphoid bone is that it has a retrograde blood supply. This means that the blood flow comes from a small vessel that enters the most distant part of the bone and flows back through the bone to give nutrition to the cells of the bone. Minor blood supply from branches of volar radial artery enters distal tubercle and supplies distal 20% of scaphoid. 80% of scaphoid receives its blood supply dorsally through branches of the radial artery. This unusual flow of blood in the scaphoid presents a problem when you sustain a scaphoid fracture. A scaphoid fracture can sever this blood flow and stop the delivery of necessary oxygen and nutrients to the bone cells. When this occurs, healing can be slow, and it may not heal at all. Symptoms. Scaphoid fractures usually cause pain and swelling in the anatomic snuff box and on the thumb side of the wrist. The pain may be severe when you move your thumb or wrist, or when you try to pinch or grasp something. With some fractures, the pain is not severe and may be mistaken for a wrist sprain, so it is important to see a doctor if your pain persists after the injury. Prompt treatment of a scaphoid fracture will help avoid potential complications. Diagnosis. Your doctor will ask you about your medical history and how your injury occurred. He will ask you to describe your symptoms. Then he will examine your wrist. With most fractures, there will be tenderness directly over the scaphoid in the anatomic snuff box dorsally, and scaphoid tubercle tenderness volarly. The doctor will perform scaphoid compression test. The test is positive when pain reproduced with axial load applied through thumb metacarpal. Your doctor will order an X-ray to help determine if you have a scaphoid fracture and whether the broken pieces of bone are displaced. An X-ray will also help your doctor determine if you have any other fractures. Standard radiographs must include postero-anterior, true lateral, and scaphoid views of the wrist. The scaphoid view is a postero-anterior picture taken with the wrist in full pronation and ulnar deviation. This view shows the scaphoid in its longitudinal axis without superimposed shadows from the distal radius. Knowledge of normal carpal anatomy is essential for determining the presence of a fracture or dislocation, for example trans-scaphoid perilunate dislocation. Plain posteroanterior radiographs should be evaluated for signs of ligament disruption, specifically, of the scapholunate ligament. These signs include a widened space between the scaphoid and the lunate more than 3 mm. In lateral radiographs, the scapholunate angle should fall between 30 and 60 degrees. This angle is formed by a line bisecting the scaphoid in its longitudinal axis and another line bisecting the lunate. In some cases, a scaphoid fracture does not show up on an X-ray right away. If your doctor suspects that you have a fracture but it is not visible on X-ray, he may recommend that you wear a wrist splint or cast for 2 to 3 weeks and then return for a follow-up X-ray. If an immediate diagnosis is needed, your doctor may order an MRI or CT scan. Treatment. The treatment will depend on the location of the break in the bone, whether the bone fragments are displaced, and how long ago your injury occurred. Non-surgical treatment. Non-displaced fractures of the distal scaphoid can be treated in a short-arm thumb spica cast, typically for 6 to 10 weeks. Non-displaced fractures at the waist or proximal third of the scaphoid can be treated in a long-arm thumb spica cast for 6 weeks, followed by a short-arm cast until healing is documented. Healing time varies from patient to patient. Your doctor will monitor your healing with periodic X-rays every 2 weeks. Your doctor may recommend the use of a bone stimulator to assist in fracture healing. This small device delivers low-intensity ultrasonic or pulsed electromagnetic waves that stimulate healing. Surgical treatment. All fractures that are displaced more than 1 mm should be referred for surgery. Comminuted fractures. Proximal pole fractures. Delayed treatment more than 4 weeks. Fractures associated with perilunate dislocation. Scapholunate angle more than 60 degrees. And if the patient is unwilling or unable to wear a cast for long period of time in non-displaced waist and proximal third fractures and he desires for faster return to work and sport. The surgical treatment is internal fixation with special screws or Kirschner wires. Percutaneously, or by open surgery. Each has its own indications. In some cases, a bone graft may be used with or without internal fixation. A bone graft is new bone that is placed around the broken bone. The graft may be taken from the radius bone in the same arm or from the iliac bone. After surgery, you will usually be in a cast for 8 to 12 weeks. The healing is monitored with periodic X-rays every 2 weeks. The cast is removed once an X-ray shows the fracture is healed. The doctor will prescribe non-steroidal anti-inflammation drugs, NSAIDs, to relieve pain, and anti-edema drugs to reduce swelling. You have to avoid smoking, which can delay or prevent fracture healing. Whether your treatment is surgical or non-surgical, you'll likely need physiotherapy for 2 or 3 months after the cast is removed to regain strength and mobility in your wrist and muscles around it. Unfortunately, some patients may not recover the same range of motion and strength that they had before their injury despite hand therapy and a great deal of effort by the patient. Return to work or play. Athletes and workers must continue to wear protection splint for 2 months after radiographic healing is noted. To return to sports participation, the athlete should have full range of motion, strength equal to the uninjured wrist, minimal to no pain. In many sports where wrist movement is not primarily involved, such as swimming or running, it is possible to return while in a well-fitted wrist brace. In sports with more demand on wrist function, such as basketball and tennis, union should be confirmed with CT scan before allowing gradually return to full active level. In sports requiring a very high load of wrist strength or motion, such as weightlifting and boxing, we recommend a minimum period of 6 to 12 weeks after union is confirmed before full activity level. Complications. Non-union. As we said previously, arterial flow to the scaphoid enters via the distal pole and travels to the proximal pole. Because of this type of blood supply, a scaphoid fracture can sever this blood flow and stop the delivery of necessary oxygen and nutrients to the bone cells, increasing the risk of non-union, particularly with fractures at the waist and proximal end. If the scaphoid fracture does not heal within 6 months, your doctor may consider surgery to insert a bone graft. He may use a special kind of graft with its own blood supply called vascularized bone graft. Osteonecrosis. When the blood supply to the bone is disrupted by the fracture, the bone cells will die. This condition is called avascular necrosis. A vascularized bone graft is the most effective treatment for this condition, providing the bone has not collapsed significantly or arthritis has not developed in the wrist. Osteoarthritis. Over time, non-union and avascular necrosis of the scaphoid can lead to osteoarthritis of the wrist. Osteoarthritis occurs when the articular cartilage becomes worn and frayed. At first, the treatment for osteoarthritis focuses on improving symptoms. This may include taking anti-inflammatory medicine NSAIDs and avoiding activities that aggravate the symptoms. Sometimes, a steroid injection into the wrist may help relieve pain. If conservative treatment does not relieve the symptoms, your doctor may recommend surgery.